Okay, good morning or good afternoon, everybody. I'm Jay Remley. I'm Vice Chairman of the Board for the Lupus Foundation, and welcome to Office Hours with Dr. Parsa. Here, it's been a few weeks since we had our time here with Dr. Parsa, but wanted to welcome everybody, to our Facebook Live event. Encourage everyone to ask questions and make this interactive as we go. And again, if you want to ask questions live, feel free to do that through our Facebook page, or you can email us at communications@lfnc.org, just here behind my background, or you can get more information, on this through lfnc.org/COVID-19 here behind us. So today we've had quite a few questions that came up since our last Facebook Live event, Office Hours with Dr. Parsa here, and so I'm going to touch on those towards the end of our 30-minute session here. We're going to try to keep it to 30-40 minutes, depending on the questions we get. But this topic today is that we've gotten a lot of questions coming in through the Lupus Foundation around with the flu season coming up, COVID-19. Obviously, we're hearing phase 2 of COVID-19 in Europe, the UK, France, and other countries. We're seeing increased cases, here in the US. And so obviously, anyone with a chronic, autoimmune disease like lupus, it's important to stay safe and healthy, during these times. And so we wanted to, talk about, telehealth, with flu season coming up, and COVID-19 will be our main topic here today with Dr. Parsa. And then also, like I said, we've got 3 or 4 questions that have come up since our last session that we'll answer here as well. So with that, welcome, Dr. Parsa. It's great to see you again, as always, here over Zoom. Great. So let me just tee it up here. We'll jump in. As I had mentioned here, so telehealth, we've seen a huge increase in the medicine, if you will, especially during COVID-19 now, with most insurance companies covering telehealth, visits with physicians, with their primary care physicians and so forth. It's becoming much more mainstream as we've had shelter in place and so forth. And we don't really see that slowing down. I think, especially even post-COVID, it's just maybe an easier way and safer way of staying in your own home to be able to get, patient care and not having to go out into the hospitals, emergency rooms, or even physicians' offices, right? And being exposed to other patients that may be sick there in the waiting room and whatnot. So it definitely feels like, telemedicine is here to stay as more of a mainstream, way of more conveniently, seeing your physician and so forth. But Dr. Parsa, I wanted to kind of get your take from your perspective, your experience. We're now 6 to 7 months into this, pandemic, and especially with flu season coming up. What advice can you give to, or thoughts do you have for the lupus patients out there and the lupus community around, how to best leverage, telemedicine, especially, like I said, with the flu season and COVID-19 continuing here?
Good morning, everyone. Good morning, Jay. Thank you for hosting us again. And it's a real great pleasure just having the lupus patient as an audience, or other people just listening to our webinar. As you just mentioned, we're getting close to the cold season, which we're expecting, having higher rate of the upper respiratory tract infection, mostly likely the viral diseases, causing this. And the question is going to come up, how we can tell if you have the COVID or it is the non-COVID other viruses, causing the symptom that the patient had. I think that having the technology of the telemedicine, it has been a great help, because, most of the patient doesn't need necessarily just travel, commute, go into the heavily congested area of the emergency room, urgent care, and having the higher chance of, contracting viruses if they haven't been contracted the virus. So I would recommend if any of the patient, including the lupus and autoimmune patient, started having any symptom before going to the office, make sure just with your primary care physician or any telehealth medicine to just talk to see if this is something that you need further evaluation or do something about it, or you would be able to monitor it, especially if your symptom is very mild. So I think that, the telemedicine, it's a good start to triage and, stratify the patients, to the low risk medium risk, and a high risk, and probably just a low risk and intermediate risk doesn't need necessarily to go for other places to do testing, or if you do, they don't need to go to the heavily populated offices that has a chance of contraction over there. At the same time, sometimes the symptom that you might have might not be just related to the COVID. It might be something simpler, like an allergy or something. So again, I would highly recommend, if there would be any symptom existing, just start with the telehealth and your primary care, or any services that you have that you can talk to any healthcare provider to just listen to your symptoms and give you an advice. And we just minimize the number of the patient that does necessarily need to go to the higher level for more care, more testing, and more intervention for the patients.
Yeah.
Uh,
Yeah, that sounds actually like a reasonable approach. I mean, more than likely, you can probably solve a lot of diagnosis and symptoms over telemedicine, just like you and I are talking here. You can see the patient, you can see physically how they look and feel, and so forth. But it's probably a good way to maybe triage and minimize probably 50-60% maybe of the patient traffic coming into the more congested or infected areas, like doctors' offices and waiting rooms and hospitals and urgent cares and so forth. So I guess we could, being in high tech most of my career, it's kind of like back in the day, you didn't run your computer into Geek Squad 100% of the time. You'd make a phone call and try to do as much as you can remotely, right? And then only go in if you have to. And it sounds like telemedicine is enabling us to do that in the medical industry now, versus before, if you had any symptoms, you pretty much had to go into the doctor's office. So that's a logical approach. I think also with that, one of the other questions that came up with telemedicine is, how can with the flu season coming into play now, as well as symptoms with COVID, are there any ways to determine, hey, do I have the flu or do I have COVID-19? And I think a lot of questions we're getting around that is, if you are feeling, sore throat, stuffy head, traditional kind of flu symptoms, how do you know is there a way to know if it is the flu versus COVID-19? What are your thoughts on that, Dr. Parsa?
That's a very good question. I would highly recommend, for at least, for the lupus patient and autoimmune disease, to invest to buying some pulse oximeter. That's something really good. You always need to have that one. We don't know how long COVID is going to be around. So that would be a good investment to just for the $20, $30, just the pulse oximeter that you can buy through the Amazon or just a local pharmacy to have. And combination of the telemedicine and having a pulse oximeter is going to give a lot of information to the healthcare provider to just make a decision for the patient. So that's the number one recommendation I would have for the patients to have it at home. Blood pressure machine, but the pulse oximeter is very crucial to have. As far as the flu and the COVID and other viruses, for the most part, it's very difficult to just distinguish if the patient has flu or having the COVID. However, there is a subgroup of the patients have some specific symptom that it hasn't been documented with the flu patients or influenza patients, like loss of the sense of taste and loss of the sense of smell, some of the rashes that is more common in the COVID. Again, increasing the possibility of the COVID if patient has any of these specific symptoms that we know that the flu usually doesn't cause any of those symptoms. So if somebody just again, have, like loss of the sense of smell and loss of the sense of taste, it's very, it's very specific for the COVID. I don't remember, reading, other viruses and other different disease, causing this. So it's very specific for COVID. But however, for the most part, it's very difficult to distinguish between the flu and the COVID. And for the again, just don't forget. Even not always we really need to know, do we have flu or do we have the COVID? As long as the patient having mild symptoms, by checking and monitoring the vital signs, most importantly, the oxygen saturation. That's the most important part, which pulse oximeter is going to giving us that one, or lack of the shortness of breath. So anyone that has some febrile disease, fever, body ache, sore throat, cough, the conventional symptom of the viral disease, as long as the vital signs are normal, as long as you can just continue with all the precautionary things to just keep your distance at the home, just make sure that keep the isolation at your room, use the mask at home, the rest of the family use the mask at home, do not use any share things with the family. Make sure that the good ventilation in the room that the patient has, opening the window is the simple way of doing it, and make sure that the air conditioning is working. Hand hygiene and washing your hand with the hand sanitizer, that would be enough. In some cases, we really want to know that if you're dealing with the COVID, then one of the things that we can do in the doctor's office, if there's a simple kit for the flu, that you can tell the patient has the flu or not. If the flu coming back positive, then we know most likely the patient has flu. And if it's coming back negative, still we don't know, is it the COVID, is it the flu, or other viruses causing this? When that situation, then we'll test for the COVID and we'll figure it out. So not every single patient, again, need to know it's what a specific virus causing this, as long as we would be able to monitor the vital signs, most importantly the oxygen saturation. So if your oxygen saturation is good, you don't have any shortness of breath, you have mild symptom, the best thing is continue with the vitamin D, zinc, and good protein and vitamin C, and make sure isolate yourself at home, stay in one room, just keep the distance with the rest of the family, minimize the contact with the rest of the family, make sure the ventilation in that room is good, high protein diet, and continue monitoring and reporting it to your healthcare provider. If any of those numbers getting bad or questionable, then we go with the next step and doing the testing, especially because we don't want to just heavily overwhelming our healthcare system. And most of these diseases, viral disease, including the COVID, it's going to go to the natural course and getting better. So I think that start with the telehealth to be triaged. If there is no specific symptom like loss of the sense of smell or sensation, it's very difficult to just distinguish between the flu and the COVID. At the doctor's office, there's some bedside tests that you can swab, the secretion from the nose and check it if the flu. Again, if it's coming back positive, then we know it's flu. If not, then we have to test for the COVID.
Okay, great. Thanks, Dr. Parsa. So just a little bit of follow up on that. So it is interesting. So sometimes it is hard to distinguish between influenza and COVID, but there's a couple symptoms that tend to be unique with COVID. And you mentioned, the loss of smell and loss of taste. So a couple symptoms there to, kind of differentiate for the most part, COVID-19 versus traditional flu. But then COVID-19 does tend to, in the more severe cases, attack the respiratory system. And so I think that's where you're saying the pulse oximeter, pick it up for $30 at your local pharmacy, monitor your blood oxygen level. What are the normal oxygen levels? So as patients, are monitoring that, what are the normal ranges they should feel okay with? And then if it drops below a certain percentage, what would that be? And what would your recommendation be then?
So for the most individual not having any previous, chronic lung disease or heart disease, we're expecting the oxygen saturation being above 95, 96, 97, 98. These are the good numbers. 93, 92 is our cutoff point, that if the number just dropping to that number and staying in that number, then that's a concern, because that means that the lungs probably involved, and probably they need to just have more intervention, including just going to the ER, or most likely ER is the better place if it's dropping, to be able to do more imaging and more testing, and if the patient needs to be admitted. So 93, 94, or if the patient has like COPD, because, previous, lung disease, chronic lung disease, or heart condition, and always, the saturation is always 94. If it drops 2 level below the number that they usually have, it's a concerning, factor. Of course, one of the things that we have to consider, if patient has any shortness of breath. Shortness of breath is a symptom that we don't like. That means that, most likely the lungs being involved. So if you have any shortness of breath, if the saturation is getting below 93 or dropping 2 level below your normal oxygen saturation, these are the signs. That means that you have to go to healthcare, places, like urgent care or emergency room for further evaluation.
Okay, great. So yeah, so monitor it if it stays in that 95 and above range. That's the normal range. If your blood oxygen level drops below, say 92, 93%, for any period of time, contact your physician. Or it sounds like any shortness of breath or trouble breathing, of course, go straight to the ER.
Exactly.
Okay. Fantastic. Well, thanks for that on the telemedicine and leveraging that. I think it's a great way to leverage technology too. And I think most people have a camera at home and on your laptop or your desktop computer. And so there is a much easier way now to engage with your primary care physician over telemedicine. And the great news, like we mentioned in the beginning, is most insurance companies now cover that as well. So it's no longer, an out-of-pocket expense for telemedicine like it was even a year or so ago. So, okay, great. Well, on that topic, we'll with telemedicine, we'll shift gears a little bit. We had 3 or 4 questions since our last office hours with you, Dr. Parsa, that I wanted to touch on here that has come in. One is there was a recent study that showed a 10x increase in death rates of COVID-19 patients who took prednisone, even at low dosage. Any comments on that? And then also any recent studies, regarding, lupus and chronic autoimmune disease with COVID-19. So maybe kind of 2 questions there I'll combine into one. The first one there regarding any higher, risk, significant higher risk if patients on prednisone, and then any other studies that maybe have come in the last 2 to 3 weeks that you're aware of that you'd like to share. So.
Sure. Shortly, I would just review for everyone what is the study meaning. So we have some observational study that, like in special, center, health center, they're checking, the number of the patients are coming, and they're just comparing 2 things in the 2 group. But as you know, a lot of studies comes with something that would just meddling with the result, and that is the bias. Bias means that we are comparing apple to the orange, and which is, they look like apple, by looking at it, but just they're 2 different things. So a lot of these studies being published, these are observational studies, which they haven't been randomized, means that, putting the 2 group with the same, risk factor, the same things, and minimizing the biases. So most of these studies are observational, so you cannot conclude, so they're not having strong evidences behind to be able to conclude or extrapolate, a result and then publishing and making a decision based on that. There are several studies, just I was reading it actually last night, that in the suburb of the New York, which was heavily congested and heavily infested with the COVID, they showed the people with the high dose of steroid taking the and contracted the COVID, they had the 4% mortality rate, which we're talking about the 2% mortality rate for the normal population for the COVID, with the COVID. So to me, this 4% doesn't necessarily mean statistically being significant. It's to us, it's different. 2 versus 4 is twice as the normal population. But again, don't forget, none of these studies had been randomized to just remove the biases and not having the result to be just be misguided by that. But number one thing I will recommend, if you're on immunosuppressant medication like Amoran, your methotrexate, or some of these biological, medication that they're taking, or in the high dose of the steroid, once you started having any symptom, make sure that you contact through the telemedicine with your healthcare provider. The recommendation for this, I don't want to go through the detail, it would be guided by the rheumatologist or the physician that you're contacting, is to just tapering it down to the lower than 10 milligram of the steroid, and then 10 milligram and below almost have the same risk and the outcome as the normal population. And they can resume that the steroid later once the patient recover from the COVID. So the only thing that we need to know, if you're on the high dose of steroid or you're on immunosuppressant medications, some of the biological that you're taking, methotrexate, leflunomide, and other medication, make sure to contact the rheumatologist, and they would just guide you based on your clinical condition individually, what is the best next of action you have to take to just be safe. But generally speaking, the studies from the suburb of the New York concluded there is no higher chance for autoimmune disease, including the lupus patient, of contracting the COVID or having higher mortality so far. Again, none of these studies has been randomized. We didn't have any of those, but so far there is no evidences, showing that the lupus patient is at increased risk for contracting or having the bad outcome because of the COVID. But just again, I'm repeating this again. If you are on a high dose of steroid, if you are on the biological immunosuppressant, make sure you contact once you start having any symptom to be guided properly by the healthcare professional to just safely guide you to the right place, which they would tell you based on your individual numbers and clinical scenarios and what dosage you are on. I wouldn't go through the detail, but what we recommend, we usually just go down on the dosage of the steroid gradually, tapering it down to less than 10 milligram to make sure that the patient is safe. Continue taking the vitamin D. I cannot emphasize on the vitamin D. We want the patients, all patients, mostly the one that has autoimmune disease, to keep the vitamin D above 65. 65 and above is a very safe. This immunomodulatory effect of the vitamin D start working at this dosage. If your vitamin D is 32, it is still considered normal, but the immunomodulatory effect of the vitamin D is not there. So make sure get to the 65 and above, and you're going to be safe.
Okay, great. Thanks, Dr. Parsa. So, so it sounds like, just answering that question, there's no statistically, significant studies that show that lupus patients on prednisone are at a significantly higher risk. The one question coming in, and I'm not sure where this, community member saw the study, but a 10x, increase in mortality rate is definitely not something that you've seen or have seen any research coming across. So it's great to understand. And then also, I think it's, as usual, there is a higher risk, of course, when you have an autoimmune disease like lupus, but not a 10x increase. It's a couple percentage points, to your point, 2 to 4% range. So, okay, that sounds good. Well, this other question, you touched on it here a little bit. The question is, what actions can lupus patients take to reduce the probability of contracting COVID-19 other than the usual precautions, right? So we're all aware of, continually washing our hands and using hand sanitizer and, wearing a mask and social distancing and so forth. You touched on one there, I think, which was interesting, as far as, what can we do to build up our immune system, right? Protecting ourselves, maybe it's through diet or supplements. And you just touched on vitamin D there as an example, and making sure when you have your blood work done, your vitamin D is at 65 or above. Interesting. I know there was a study that came out of Stanford here just earlier this year, not too long ago, that showed somewhere around, 40 to 50% of the US population has vitamin D deficiency. And that's for various reasons. Some of it is, we're working indoors a lot more now and we're not getting much, sunlight per se. Less and less of the population is in the outdoors, professions like agriculture and so forth. More of us are sitting behind a desk or indoors or, on a Zoom meeting like this and not getting outside and getting that vitamin D through sunlight. But in addition, maybe if you could touch on that, what are some things, that patients can do above and beyond, what we always hear to help boost their immune system and protect them from maybe not even just COVID-19, but just influenza and the flu in general here as we're coming into the flu season?
Sure. I want to just, mention something that, I've been seeing, a lot with the people that washing their hand too much, that they're getting the eczema, dermatitis, and, dry, skin is very common. I will recommend all of the patient, as long as you don't see any obvious dirt on your hand, just washing your hand once or twice a day is enough. Use the hand sanitizer in between. I'm doing sometimes the surgeries too. So as a surgeon, when we want to go to the room and just go in and operating, all we need to do is if there is no obvious dirt on the hand or is a second case that we're doing, we don't wash our hand that much. All we do is adding the hand sanitizer with the moisturizer, because we don't want to just, causing, the second damage to the skin because of the too much washing of the hands. So as long as there is no obvious, dirt on your hand or anything that, once or twice a day, washing your hand is enough. In between, try to use the hand sanitizer that has moisturizer in it, because we want to prevent any other dermatitis, eczema, or other problem with the skin. Regarding the vitamin D, I think that the study that the Stanford just mentioned, 40-50%, the cutoff point was the 30. If we look at the 50 and above, and our goal vitamin D is 65, I believe that 80-90% of the population doesn't have that immunomodulatory dosage of the vitamin D in their body. Even if, so number one, make sure that you check your vitamin D at some level. Ask your primary physician to be checked, because unfortunately it's not part of the routine, annual exam to be checked, which I believe that, it should be included. Ask your primary physician to check your vitamin D. Make sure that you get aggressive treatment to bring it up above the 50, preferably 65 and above, and you're going to be safe. So for having the good immune system, there are three factors for the immune system. Number one is genetic, that we cannot do anything about it. We were born with the blueprint of the genetic that we have, and we cannot do much about it. Number two is the nutrition. Make sure that you get enough protein. I would highly recommend that the protein is the number one thing. All the antibody, the function of the immune system, they're all dependent on the protein level that we have to take. The minimum daily protein for normal average, weight person in a day is 60 plus grams of the protein. If you're sick, if you have other condition, if you're bigger than normal, then your level of the protein that you need is probably 80 to 100 grams. I will recommend everyone to make sure that, supplemental protein shake, make sure it's organic, number one, and then get the 60 grams of the protein shake. That would be good things to make sure and reassure that you're getting enough protein. The other thing is protein shakes doesn't need to be digested to be absorbed. So the protein, the building block, which is the amino acid, is already there and easily would be absorbed by the body. But of course, make sure it's plant derived and also is organic. So 60 plus gram of the protein daily. Make sure you're taking one multivitamin. The rationale for me that, to recommending the multivitamin is because inside the multivitamin, most of them has some trace element. Some of these trace element has major role in the immune system, like zinc. And by taking one multivitamin that has mineral in it, it would, because it depends. Sometimes, on a daily basis, we might not taking all these trace element in our food. So that would be a reassurance, and make sure that we're getting all these trace element. So take one multivitamin that has some good minerals in it, and of course, preferably gluten-free. So that would be helping us to just make sure we get all the minerals and the vitamins that we need. And the other thing is continue with the zinc of the 25 milligram, 1,000 milligram of the vitamin C, and 5,000 of the vitamin D. If your vitamin D is lower, I would recommend to go even to the higher dosage individually. Talk to your primary physician. Unfortunately, the guidelines, when you look at it, they're recommending for the vitamin D deficiency to go with the 2000. I have been treating, the vitamin D deficiency patient for the last 10 years. And I'm telling you, with the 2000 a day, it takes forever that the vitamin D to be corrected. Sometimes, it's impossible. The fact is, when you're vitamin D deficient, the receptor in your intestine is also would be decreased, not absorbing enough the vitamin D. So we need the larger dosage of the vitamin D to just correct this deficiency that is a pandemic. And if you're calling the cutoff point at the 50, the deficiency is more than 50%. I believe it should be above 80% of the people have the low vitamin D, less than 50. And the sunlight for the lupus patient, these are the subcategory of the people. I would recommend try not to get your vitamin D through the sunlight, because the sunlight could just trigger and reactivate the lupus. And so I would recommend to just, solely focus on the dietary vitamin D, especially if you're going outside and it's the sun. Don't forget to use the sunscreen and refresh it every 2 hours, because we know the sunlight can reactivate the lupus. So dietary vitamin D, zinc 25 milligram, 1000 milligram of the vitamin C, one good multivitamin that has all the minerals and vitamin in it, a balanced diet, and a 60 plus grams of the protein, organic one would be, and then, so that's the second part. So we talked about the genetic, that's a diet. And number 3 is the mind. Again, make sure that you get good sleep, because lack of sleep is immunosuppression. If you're not sleeping enough for the 48 hours back to back, your immune system definitely not working well. So make sure you get good quality of sleep. Again, good quality of sleep means that if you have a sleep apnea, discuss it with your primary physician to just, prescribing or doing things that is good for you. Make sure if you have some insomnia, discuss it with your primary physician. Get some help from melatonin and some of the good, supplement that you can take. And positive thinking is very important to just have a good immune system. So mind and nutrition and genetics are the triangle of the immune system.
I love that. So that's fantastic, Dr. Parsa. Yeah, genetics, our DNA, we're born with that. That's our fixed structure, as humans, and there's nothing we can do about that. But there is a lot we can control and influence, right? As far as our diet, our health, making sure we understand the various, important, blood levels within our body, right? Like our vitamin D level, vitamin C level, and so forth. And then, yeah, so much also is in the mind, right? Having a positive attitude, a positive, outlook. Every day we wake up is a great day. And so I can't thank you enough for, sharing your insights and answering, those questions. I know that you've got me on 5,000 UI of vitamin D every day, and I'm taking my 1,000, milligrams of vitamin C every day, and zinc. And so it's been great advice you've had for my wife and I. My wife has, as you know, Sivy has lupus and was diagnosed quite a while ago, 1993, and fortunately doing well, but managing it through a lot of your recommendations here that you mentioned, right? There's not much we can do about our DNA, that's what we were born with, but there is a lot we can do and a lot we can control, through living a healthy lifestyle, healthy diet, and making sure we get some sleep. So sleep and rest. So with that, I don't believe we have any other questions. I know we're a little over our 30 minutes here with you. Let me just check one last time for any questions coming through Facebook Live as well. And I don't see anything else, but I will say this. Thank you again, Dr. Parsa. It's always wonderful to see you, and all of us here at the Lupus Foundation are very grateful for the time you spend with us and our community and our patients and members. And for all of you out there, feel free, again, reach out to us anytime here, wrong one, up here at communications@lfnc.org. Send us any of your questions. And if we don't get to them before our next office hours, we'll make sure we answer them during our next office hours here with Dr. Parsa. So again, every other Saturday, 10 a.m. Pacific time is our schedule here with Dr. Parsa, and office hours with Dr. Parsa for the Lupus Foundation. So with that, we will sign off. and see everyone in 2 weeks from now. So have a wonderful rest of your weekend, afternoon, wherever you may be. And same goes to you, Dr. Parsa. Thank you so much again. It's always wonderful to see you.
Appreciate that.
Bye-bye, everybody.
Take care.